Gordon joins us. Hi, Gordon.
Hi.
How are you?
Hi.
Hi,
Good. Hello, Carla.
Hi, God. Good evening, child. Good evening,
Hi.
everybody.
Good evening to you.
Hi, everybody. Can you see me, JL?
I cannot see you. But that's okay. We could talk to you.
Okay.
All right. We could talk to you because we can hear you just fine. And Carla is here with us. Carla, you're in the UK right now. And so are you, right, Sarah? Sorry, you can
Come
hear
again?
me?
Yeah, you just broke up for 2 seconds there.
I'm not sure if Sarah can hear me.
You're good. You're good.
Yeah, I can hear you.
Yes, I can hear you.
I can hear you.
All right. So, Sarah, you're on the front line. How is that working out for you? Like, what exactly does it entail being a nurse right now in the UK amidst this COVID-19?
To be honest, JL, it can be extremely stressful. However, we have the support from our employer. When our patients come to the front entrance, actually, once this COVID-19 had escalated, we had changed our entry and exit to and out of the hospital. So we have one main entrance for our patients and relatives and carers, and we have another side entrance for our staff. So now we've had to restrict the staff entrance, and so everyone comes through one door and leaves through the same door. So before you enter the hospital, you are asked if you have been traveling, if you have a fever, if you feel well, and your temperature is taken. And on the desk is also some hand gel, so you can use hand gel to clean your hands before you enter the hospital and when you leave. We've had to actually assess and manage how we deal with patients since the COVID-19 has come into existence. So we've had to categorize patients who will now have surgery. So patients, for example, we have compiled a list of at-risk patients, for example, the over 70s, patients who have respiratory problems such as chronic obstructive pulmonary disease and asthmatic patients and other respiratory illnesses and diseases like lung cancer, patients who are diabetic, patients who are immunocompromised like HIV patients, and patients who have other systemic comorbidities. Our priority as working as a nurse in an eye hospital is saving sight. So if it's a routine elective surgery, it's more or less put on hold. For patients who have ocular oncology issues, they take priority. Also, I work in a pre-assessment unit. So normally before patients have their surgery, they come to our nurse-led clinic where we pre-assess them to see whether they're suitable for topical anesthesia, local with sedation, general anesthetic. So patients of all ages come through our clinics. Now, what's been happening, in view of the social distancing, we've got this new thing in place now where we actually video call the patients at the comfort of their own home, so they don't have to leave to come out to go into the hospital. So that's what we're doing at the moment.
What sort of advice would you give to people who are probably attempting to come into the hospital, or for whatever reason, or people who are actually probably thinking of visiting people who are at the hospital? What sort of advice would you give?
The thing is, we're a day hospital, so most of our cases are day cases. However, there are patients who stay over for a few nights if it's ocular oncology, if they have enucleations, if they're here for certain procedures such as having radioactive plaque, if they have an eye tumor, eye cancer, that sort of thing. So we try to limit, as it is now, we have one carer per patient. If someone is thinking of coming to the hospital, for whatever reason, we need to know what it is before they come. If it's something that's urgent, obviously, when they get to the front door of the hospital, they'll be asked why. But we are advising patients not to come out at all.
Unless it's an emergency.
Unless it's an emergency, not even to visit their GP, to call the GP, or to call the designated number of 111, which is the NHS number. So they'll be put through to someone qualified who can advise them further. We're also advising our patients to wash their hands, also to use hand sanitizers, that sort of thing. Just a general advice that everyone has been receiving.
As a nurse, how do you feel on a day-to-day basis right now?
To be honest, it's not too bad because I just
real Indian and not too bad.
Not too bad, Najaya. I came back from Dominica about 3 weeks ago, and then suddenly, bam, in my face was COVID-19. So we had, initially we started screening our patients. Have you traveled to China and the other few places, that sort of thing. And then the screening questions changed to whether you have a temperature, whether you have a cough or cold. It hasn't been too bad. We've been able to manage it. We've had many.
I know how you're doing. Because
I'm doing just fine. I'll tell you why. Because I live 5 minutes from the hospital. It doesn't take me long to get to work. Any emergency, I'm there. Also, I can't go to the gym at the moment because the gyms are closed. So I've had to be a bit creative and do my own stuff at home. For example, my little workout videos. I do have a board and dumbbells and resistance bands. So now I've had to put them to good use. And also I've noticed there's an increase in people or fitness fanatics and all these yoga gurus having their workouts, and they're doing their videoing on a more regular basis.
You're gonna be a virtual trainer for us soon.
My dear, I had to log on to Instagram and download a few things just to keep me going. There's a few things I had to do myself. I had to more or less assess my way of life and make a few changes. I'm also studying my master's in ophthalmic practice. So there's no face-to-face classes anymore. So everything is going to be computer-based, essays and practice-based learning, etc. My diet, I've had to change my diet a little bit because, to be honest, working as a nurse, sometimes you don't get the time to cook for yourself. I mean, I do cook on weekends, but you know, when you just want something quickly to eat, when you're in a hurry, it's not that easy to be planning meals at home. So, you know, with this time now where there's social distancing, I go to the supermarket, I buy more vegetables if I can find them, green leafy vegetables. I've added some more supplements to my diet, drinking a lot more water now, both bottled and filtered water. Yeah.
And advice that anybody else can take on. You know what? While I'm talking to you, Sarah, I just want to bring in Carla in on the conversation because Carla mentioned social distancing, and Carla is a social butterfly. Carla loves to meet with people and discuss with people and talk to people. Carla has the gift of gab like myself. So, Carla, how has this affected you? Because you're in the UK, you also you do a lot of you're a coach. You know that's what you do for a living. How has that affected you?
Well, to be honest with you, I think that we are in the south. I am based in Brighton and Hove, so I may not be in the thick of it as and I think we're getting a little bit of flack because people are flocking to the coast. Because if the weather is good, and so that social distancing is a bit of a challenge. But as far as me and what I do, I can move virtual with what I do, and I do also teach Pilates, and so I started already last week doing virtual classes, because obviously, I mean, as far as mental health and your whole well-being is concerned, just being able to move and know that you're doing something good for yourself is going to already put you into a better state of mind. That's also it will keep you healthier, as the nurse is saying there, so that you don't end up getting sick for another reason because you're just not moving enough. And unfortunately, I do have a lot of clients that are either have had injuries, so it's really not a good thing for them to just stop what they've been doing. And some of them I've been working with for a while and getting them out of their injury state that they can actually move perfectly well now. So it will be a shame for them to go back. So we have had to do things virtually, and actually it's not a problem for me to be up this late because I've tried to make everybody tracking to the sessions, the virtual sessions that we're having next week. So I'm trying to block everybody into the Zoom classes, as well. But as far as I'm coping with the virtual stuff, it's fine. Yes, you say I'm a social butterfly, but we actually had a cocktail hour on Friday night with some friends on Zoom. So each of us had our glass of wine or whatever, and then we were in a little cocktail party on Zoom. So we have a few community groups like that, and just groups of friends. A number of them actually. It's getting difficult to keep up, really, because you have so many of these people that you're in groups. So I think, to be very honest with you, I think we're becoming even more sociable because we're now in touch and it's a little bit more meaningful. So I think psychologically we're recognizing that we're reaching out to people even more, So I don't know if maybe this coronavirus is giving us a little pause to reevaluate what's the important things for us in life. I don't know. Maybe.
How was the whole pandemic affected you? You're in France, and France has had a few cases. I've heard some places have actually been placed in lockdown to some extent. How has that affected you as a businessman, as an entertainer? How is it affecting you?
Well, good evening. Besides cancellations of concerts, it hasn't affected me much. Probably because...
It affects the pocket.
Can you say that again?
It affects your pocket.
Oh, yeah, well, I said cancellations, but I would like to believe that there are postponements.
True.
For later dates.
Yeah. Postponed rather than canceled.
Right. And have you been in complete isolation?
Well, that's what I was about to say. My normal lifestyle is inside. I spent most of my life inside. As a matter of fact, well, I'm in a very small family. It's only my wife and myself. And my wife, who is not an entertainer, she works downstairs. So we live upstairs. She works downstairs. So we are voluntarily confined more or less most of the time. And I should tell you that France has been confined to barracks, so to speak, for the last week or so. But we have been confined a week before that.
Wow.
We went to the supermarket, to the necessary markets. We stocked up and we've been inside. I don't feel isolated and I don't feel imprisoned. It's okay for now, but it's only.
Do you feel like you're doing because of the circumstances, or you welcome the entire lockdown?
Welcome would be exaggeration. I think it's a 50-50 thing. I am used to staying days on end without going out. And when I say going out, meaning going to the supermarket or going for a walk, because we are fortunate enough to have a yard that is not a mile, a square mile, but it's enough that you can do a little running, a little skipping in the backyard, and you have the luxury, quote unquote, of having trees around and so on.
Yeah.
So it's not a big thing for me. There might be the psychological thing where we know that we are not allowed by law to live. So I don't know how this will impact life after 2 or 3 weeks, because I realize that in other European countries where they started with 14, 15 days, they have extended it to 30, and the scientists don't seem to know for how long this thing is going to last. So probably down the road. And I must say that other countries beyond Europe, I don't think it is unintelligent to not prepare for similar circumstance. I think a pandemic means pandemic. It's going to be worldwide. It is worldwide. And as I heard a scientist saying, we had two options. Is either we all walk around with masks, which is not necessarily a very sensible option, or people are confined for a period, and it seems to be working in decreasing the number of people affected.
Thank you very much, Gordon, for providing us with that. I know it's way past your bedtime, right? And I really appreciate you guys coming on and talking to us. Any final advice that you want to give anyone? I know you are both Dominicans. You have family and friends who are in Dominica. You just learned there's one confirmed case of the coronavirus in Dominica, and some people might be in shock still. Some people might be like, oh, it's just one. You know how Caribbean people are. What sort of advice would you give to your friends and family in Dominica? Carla?
If I were to dare give any form of advice, I would say treat this thing as a pandemic.
Yeah.
It is worldwide. I don't think that it is wise to believe that there, by some spiritual miracle, we are going to be spared.
Mm-hmm.
Prepare, and do as if it is a pandemic. That's all.
Well, just to close off, Jael, I would probably want to say a couple of things here. I think that just to follow on what Gordon is saying and what the nurse said and what everybody really has been saying that we could heed from is, I think the most important thing is to realize that this should really be treated as a sort of a traumatic event that we will go through. So it is important maybe that parents and people, the heads of the households, can come together with the children and start putting in place systems that can make life seem normal. Find things to do that maybe you've let slip for a long time. Nice tasks that you wanted to accomplish, that you can look towards doing these things when the time comes that you will be locked down. And so it isn't such a shock to your system, but yet you're prepared and you're looking forward to doing certain things. And I think just to bear in mind that even if some people think, oh, I am healthy, or it's okay, I can do whatever I want, I think the important thing is to just always think about other people, that it may not be so difficult for you to get over, but what if you had to live with the idea that you passed it on to your grandmother or your mother, or you gave them their friends the disease, and then the hospital had to deal with it and the healthcare providers. So I think people should just not just thinking of it as a prison imprisonment for them, but also to see themselves as part of a bigger picture and how they can also be of use and helpful and supportive. I think gives you a sense of purpose as well. So that when crunch time comes and we have to be under strict isolation and quarantine, then it's a little bit easier to do. So to take on. So that would be what I would say. To just be careful and think of others and plan ahead.